You're live, Tracy.
Hi, I'm Tracy Truelove with the Pitkin County COVID response, and joining me today, and we appreciate you being here. This is going to be a little different format. So let me start with that, and then I'll explain who's on our panel today. But we are going to have a quick update from Aspen Valley Hospital and also from Jordana Sabella and Kara Silbernagel about our consumer protection compliance part that we've been working with businesses on. And what we've opened it up, though, then to is you to provide questions for us, which we'll do our best to answer. And we really want to just stay in that Q&A button on the Zoom program, because that way we can kind of track that we're keeping up with what you're asking. We have a hard stop today at 5 o'clock. So if we don't get to your question, we're going to provide more information on our FAQs, and we'll just kind of work it through. This is a little bit new format for us, so it always takes a little bit of time to get the bugs worked out. But we appreciate you being here. And so joining me today, I have Dave Ressler from Aspen Valley Hospital, the CEO of Aspen Valley Hospital, Dr. Brad Holmes and Dr. Catherine Bernard, and again, also Jordana Sabella from Pitkin County Public Health, and Kara Silbernagel from Pitkin County Policy and Project Manager. So with that, Dave, I'm going to not spend a lot of time and kick it right over to you.
Great. Thank you, Tracy. Once again, I'm Dave Ressler, and I'm the CEO at Aspen Valley Hospital. We thought you might appreciate having an update once again about the status of our activity levels. Let me first say that we're very pleased to be carefully and methodically reopening our services for elective procedures and other services that many members of our community have been waiting for, and it's going very well. We are keeping our staff safe, certainly keeping our patients safe by separating any likelihood of an infectious patient from the rest of our patients, and also all of us are wearing masks, and that's an important part of our defense strategy. So it's going great. Thank you to our patients that have come back, and thank you to our physicians and staff that are providing the extraordinary care that we're known for. In terms of our activity levels, that too is stable and low. So, for example, on any given day for the last couple of weeks, we're seeing 1 to 2, 2 to 3 maybe patients in our emergency department. Our census is getting a little bit more activity, as it should be, for patients that are being referred by their primary care physician for an evaluation and potentially treatment, and a few patients there a day, 3 or 4 a day. On average, we've had 1 patient a day in the hospital, relatively very little activity for those that require hospitalization. And for many weeks now, we have not had to transfer a patient on a ventilator. So we're very, very pleased with that level of activity. Our testing tent, our community testing, where patients are referred by their primary care physician when you have mild symptoms that don't necessarily require care, but we want you to come in and be tested to see whether or not you have the virus, or at least receive a positive virus test or not. So again, if you have minor symptoms, think you may have the virus, call your primary care physician. If you don't have one, call ours. And you'll be referred to our tent for a test. It is free to the patient. We will bill your insurance if you have it, because they should pay their fair share. On average, we're seeing about 8 to 10 patients, and that number has increased in the last week, I think because the word is getting out that there's no cost to the patient, and we want you to come in and be tested if you think you have symptoms. So we're pleased with that level of activity, but I need to say the number of tests coming back positive, very low for those patients that are coming in to be tested. So what does all of this tell us? It tells us that the virus is still in the community. We are still getting some positive test results, but very importantly, the transmission rate is extremely low because our numbers are not increasing. And that is so encouraging because we opened the community to construction and landscaping on the 23rd of April. It's been about 3 weeks, and we're not yet seeing a rise, and we're encouraged. So on that note, as we reopen our community to the vital economy that we all need and that will support our families and restore the lifestyle that we all want to, it boils down to keeping that transmission rate low. And that means personal responsibility, all of us following the rules. And so for more on that, I'd like to turn the conversation over to Dr. Catherine Bernard, who is the Chief of Staff at Aspen Valley Hospital and also an emergency department physician, to talk about what we mean by personal responsibility. What does that entail for each of us as community members? So Dr. Bernard, if you would please take it away. You're muted.
There we go. Thanks, Dave. I appreciate that introduction, and I also agree with what you said. That is 100% accurate. The virus is not gone. We have controlled it. We have suppressed it, all of us, the whole community, by following these 5 commitments to containment. I will keep my distance, at least 6 feet. I will wear a mask. I will wash my hands frequently. I will get tested if I'm sick, and I will self-isolate if I have symptoms. And those things are so important, Dave. I say this to my friends, and I know I've said this on this meeting before, but the ER is probably one of the safest places in town, as is the whole hospital, because we really are committed to these personal things we can all do to decrease viral transmission. And thanks to us doing that, and all of you in the community doing it as well, we are not seeing increased rates of transmission, despite the fact that we are easing into a more normal level of mobility. More people are going back to work, and we maintain still our ability to take care of patients with all the normal things: heart attacks, strokes, cuts, and the small amount of COVID patients that we're seeing. So I know I've turned into a bit of a cheerleader, but yay team, way to go, everybody in this community, for doing that. And as we start reopening, easing into more normal, we have to keep doing that. That's how we're going to keep the transmission low. So I don't want to say too much more. I think Brad is going to say a few things about what we still are seeing here at the hospital. And so I'm going to turn it over to you, Brad.
Great. Thanks, Catherine. Hi, everyone. Good to be back. I thought I would discuss a few things in lines. And yes, I completely agree with everything Dave said and Dr. Bernard. So I thought I would take the time to address a few things that I've been hearing and seeing on the internet and on Facebook and various in the paper and chat columns and things. So I just wanted to clarify a few things, and I know there's a lot of different information going around, and sometimes it can be difficult to know what's true, what's not, or what's partially true. So I thought I would just address a couple things that I've been hearing, or questions that I've been asked multiple times. First off, I just want to reiterate, the COVID-19 is not like the flu. It's very different. This is something that I've been practicing physician now for 12 years, and this is something unlike I've seen before. And I was practicing back when the H1N1 swine flu came around, and we saw a lot of bad infections, a lot of pneumonia then. And this is very different. This is something much more serious. Most people will either have mild symptoms or maybe moderate symptoms, and we even know that there's a number of people that won't have any symptoms, and that's part of the problem as to why the disease is spreading so easily. But I have personally seen several people who are in their 40s and 50s and who are generally pretty healthy people who have ended up on life support and had to be transferred out of our hospital. So this is not just a disease of the elderly and people in nursing homes, although those are the people who are at highest risk. But it can affect everyone and anyone, and we're seeing it in a number of younger people as well. The other thing is that this is still a very new disease, and there's a lot of things that we're still learning. We know now, we've relatively recently learned that there's a significant increased risk of having blood clots. And we're hearing now about all the cases of children in New York and in other states having what they call Kawasaki disease-like illness that may or may not be related to it. We just don't know. There's so limited information, but there's a lot of things that we're just still learning. So I just want to reinforce that this is something different and something we should take very seriously. One of the other questions that has repeatedly come up is, why do we need to wear masks? and one of the things that's been pointed out is the CDC initially said we didn't need to wear it, and then they changed their minds and now recommend that everybody wears masks. And so first off, masks, they may not provide much protection for myself if I wear one, but the big thing that we know that they do is that they can help people prevent spreading their illnesses to other people. And as I mentioned, there's a number of people who won't have any symptoms or may just have mild symptoms, and they're still going to be out in the community doing their usual business. So it's important that we all wear masks because you might be sick with it and you may not even know. And these masks will help prevent spreading the illness to other people. And as I said, because there's such limited data on everything, and this is such a new disease, nobody's really had a chance to do studies on this specifically, or even this scenario. So, we don't have the evidence to back that up, but we've been able to look at other things that are similar to it and know that this is going to be true, that these things will protect us. Another one is, well, why do we need to keep 6 feet apart, especially if we're wearing masks? Well, you may have read, you may have seen that this virus is mostly spread through our respiratory system, and we can spread droplets into the air, and they may stay in the air for a while. So they've done some calculations. They came up with the 6 feet, and that is likely a safe distance, but I think that's also going to depend on exactly what you're doing. If I'm standing next to somebody and they're talking to me, if I'm just a couple of feet away, it's a good chance I may be exposed to that virus. But if they're 6 feet away and they're just talking, then it's likely going to be safer. And that's why, again, another reason to wear the mask. But I've seen stories, and I think a lot of us have heard about the choir group that I think it was 40-something people out of 60 choir members were infected. And, as you can imagine, the singers they're singing, they're putting out a lot of force, so they might even go further than 6 feet, and definitely further than the 1 or 2 feet. So, and I would also take that in, you should consider when you're doing other things. So if you're outside and exercising and, breathing hard, you could potentially, maybe spread more than just a couple feet, more than a few feet. So again, this is why the social distancing is very important, and maintaining that 6 feet of distance, and if you can, maybe even further, I would recommend. So those are a few things that I've heard come up, and I just wanted to mention, but I completely agree with what's been said before me, and we really need to kind of stick to these 5 commitments of, maintaining our distance, covering our face, very important to wash our hands, and I think we all know why for that one. And also just very important, if you feel sick, please stay home. There's, even if it's not COVID-19, it might be something else that you could spread to someone, and then they may get sick and have to be tested and be quarantined. And so please, if you're feeling unwell, remain home. And again, as Dave mentioned, we've scaled up our testing, and anyone that has symptoms, we want you to come get tested. So please, it's going to be one of the best ways to contain this and box it in. The county's worked very hard on developing a team of people that will be able to trace the virus, so that will be immensely helpful. So please, if you do have symptoms, stay home other than to come in and get your test. So I just want to encourage everyone to do those things, and encourage others around you. So, and especially if you have other people coming to your home to do work, if you are in a business of some sort, please encourage other people around you to do these things, because at worst, even if we find that these things aren't totally necessary, well, then we all got to wear some masks for some homemade masks that for a little while. But if it is true that these measures will all work, as the majority of us truly believe, then we will significantly reduce the amount of infections, and we will allow businesses to get open back to usual. We'll all be able to go back to doing our thing that much faster. And most importantly, it'll save lives. So I think that's it for me. And I know at the end we'll have a chance for some questions. So hopefully I can answer a lot of those. Thank you.
Great. Thank you to the Aspen Valley Hospital team. They're going to be here to help us answer questions. For those of you who have tuned in when we'd already started or didn't quite catch what I suggested, we're doing a little different format today. where you can use the Q&A button at the bottom of the Zoom screen. See, there's about 110 people tuning into this right now, but if you have a question for us, use that Q&A button, send it in. We're going to have Jordana and Kara do a quick update as well, but then we'd really like to hear from you and find out what those things are that you're curious about that we can answer. And there's always the likelihood too that we aren't going to have an answer here today, but we're doing our best to track those down and provide those in on our website and in FAQs that we have. So we're moving over to Jordana Sabella and Kara around the consumer protection is kind of how we're talking about it, gang. And I guess, you know, the things we're doing with businesses to help them get comfortable with reopening and how to start seeing people come back to their businesses. So I'm going to start with you, Jordana.
Thanks, Tracy. Andrew, can you give me permission to share my screen, please? And while I'm doing that, Kara, I'll turn it over to you to begin talking.
Go ahead, Jordana.
Thank you.
So while Jordana's gonna, while Jordan's bringing that up, we spoke with you guys, we spoke with the community last week about the business safety plan checklist and the consumer protection program. And really just want to build off of what Aspen Valley Hospital said and what this means, building on those 5 commitments that we've been talking about for our community and how we start to look at that as it builds the foundation for reopening our economy. And really, the business safety plan checklist is how we think about looking forward, how we slowly move from each phase to the next phase, making sure that we're all taking in the protocols, we're using the data that we're hearing, and we're helping all of the businesses and all of those practices that we're all new, that we're all adjusting to, move forward, and then also helping be that communication piece back to our employees, our customers, and our eventual visitors, that we've been taking this seriously the whole time, and we are going to be a safe place for anyone to want to come for the long term. So next slide, Jordana. Thank you. Again, as mentioned, is we've set up a process that can take place for businesses to open within phase 1. If you are unsure, we've created a roadmap to reopening, which is on the website, and that outlines which businesses are able to open under phase 1, and as well as how to submit a business safety plan checklist. Just to be very clear, every business that will be reopening needs to submit a business safety plan checklist. And we fielded a lot of questions about, if I have one office building and 3 different functions in there, just do I file 1 or 3? And if you have any questions, just submit it to the business liaison at pickenscounty.com, and we can help answer your specific questions. So there are some differences, such as disinfections might be different between businesses, and so again, encourage business liaison, and we can help do that research. So next slide. So really the key components that are in this safety plan as we think about, this is the new normal. What are the workplaces when we start to look at coming out of this and the slowly reopening, is just like Dr. Bernard spoke about, is it's really about promoting our health, right? Promoting and protecting employee health. What are the measures you're doing to educate and talk with your employees about these new protocols and the expectations of how to take care of one another, and when you're sick, to stay home and not come to work sick. Additionally, promoting clean hands and washing your hands very often, more so than we've ever thought probably in the workplace. And that's going to be critical as we start to move forward in each of these future phases, as well as the disinfection protocols. Some of these protocols are very different than we're accustomed to. We're getting great guidance from CDC and from industries. And so again, it might change versus sector, but there's some great pieces there of how we think about disinfecting, continuing to promote that social distancing and reducing unnecessary contact points. And also really think about, in this valley, how do we reduce exposure through transportation? We're limiting, trying to keep that exposure risk without, is not part of the household unit. So thinking through, how are employees, how are your customers traveling throughout different aspects of your business model? And lastly, again, this is the new normal. How do we monitor it, and how are we communicating that your business, you're taking this seriously. You understand the vital importance of the health and safety of our community and also want to start to reopen our economy. And so how are you communicating it with your employees, with your customers, and the community? Next slide. And so one of the key ways that we've identified doing this is every business that submits a business safety plan checklist, when you submit that plan, you'll get a PDF and you'll get a copy of a printable version of this sign. And what this sign means is you can put it in your window, you can put it on your front desk, wherever it is, but it's a signal that you've done the measures, you've looked into it, you're doing the research, and you are taking this seriously and have implemented the measures as we begin to do phase 1 and are a safe place for both your employees and your customers moving forward. And so with that, if you have any additional questions or need assistance, as we said, there's resources on the roadmap. We're further developing the FAQs daily. State guidance is continuing to evolve. And again, reach out to that business liaison at pickenscounty.com if you have further questions or need assistance. And with that, I'll hand it over to Jordana.
Thanks, Sarah. So this is Jordana Sabella from Pickens County Public Health. And I'll talk a little bit more about our public health order compliance and consumer protection team. We're a team right now of 7 folks. We've got individuals from the city, environmental health specialists, public health specialists, and the county who are really looking at our recovery long-term. This liaison who's contracted to really be an advocate for different industries and how they can open safely amidst COVID-19. So we've fielded over 158 questions and have done additional research on a number of different questions that community and business members have had since just last Thursday. Last week we had 2 town hall meetings. One had over 200 participants, one had nearly 100, and so from those meetings, we've developed a lot of frequently asked questions that are available on the website, and you can also watch the recordings of those meetings for additional information. We wanted to share a little bit about what our process is. When you do email business liaison at Pickens County, if you have questions about the public health order or what it means to open your business safely in this new normal, you can email that email address. Your question will go to the subject matter expert who's been learning and developing their depth of knowledge around those specific areas that you're inquiring about. So we've been digging into everything from construction and landscaping to childcare, restaurants, summer camps, outfitters and guides, and all different kinds of questions about what does it mean to open a business and operate safely in this new world where we're really wanting to prevent the spread of COVID-19. Once those subject matter experts look at your question, if they can answer them by existing frequently asked questions or existing state guidance or county precedent, if we already answered this kind of a question, we'll get back to you right away with those responses. If you've asked a question that we don't have an answer to yet, we're going to have to go and do some research. So we're going to look at similar guidance, what's the rationale for making this decision, and then public health is really going to review that research and determine, make a determination and give you some definite guidance. Once that gets back to you, we're going to update our frequently asked questions, so anyone with the same kind of question will have access to that answer. So that's how we're addressing this on the back end. We just wanted to share one way that we're thinking about risk tolerance, and this is helpful for the community to know as well. When we're thinking about what are the things that can open in phase 1 and that people can get back to doing safely, we're thinking about what is the least risky kind of activities and behaviors. So these are low-touch environments where you're performing some kind of individual activity, and those are going to be really good to go with these guidelines that we're providing in phase 1. We recognize phase 2 might move to those kinds of activities and that have maybe a higher touch and are really a moderate risk. And the last kinds of activities that we're going to be able to see become available to us as a community are really those that are the highest risk, that will have really high touch environments and where there are group activities going on. So those are the things that are going to take the longest to come back online. So just for the community to have a sense of how we're making these decisions, what are the criteria that we're looking at, and what kind of best practice we're using going forward to make those decisions, I think is great for everyone to be on the same page about. So again, for more information, please go to our website. We will be continuing to update that with lots of different resources as we go forward.
Great, thank you, Jordana and Kara. And thank you to our audience who's actually sending in some great questions. So I'm gonna jump right in. Is the panel, can you all hear me? We're all good to go? Okay, so the first one will go towards Jordana and Kara. Can you talk about daycares? What are the ratios of teachers to students? We're supposed to go back to daycare on June 1 with only 10 students and 2 teachers. If we are in phase 2, would the amount of children allowed in the classroom go up?
I'll give
it a shot. You know, the daycare piece is definitely really difficult for even the daycares themselves. And so what we're really looking at is that June 1st date. Again, it's really leaving it up to what we're hearing from the state guidance is it's up to the daycares. What is it that they feel comfortable with? A lot of them are going to see their own tolerance level because of some of these practices that need to be put into place. And that, I forgot the second part of that.
I think the other
on the ratio right now is 10 to 2 teachers.
I think we're continuing to look for guidance from the state if that's going to change in phase 2. And then, you know, I can't see who right now wrote in the question, but if you haven't connected with Kids First, you know, they're providing a lot of support locally to make that financially feasible to open with those lower ratios of less children to more teachers.
And also, if we haven't fully answered it, please send these questions into our business liaison. We'll also kind of share these with that team after this is over. Aspen Valley Hospital team, I don't know if you want to tackle this one. We've got a good question. Considering current infection rates, what do you expect the threshold data would be which would make rescinding the mask law reasonable?
Well, I'll take a stab at that because it actually raises a really important opportunity for the hospital and the physicians. 2 of them are here on in this meeting that are part of what we call our medical advisory team that are providing feedback to and data into the public health to help make these decisions. So I don't have a rate or a number that I've heard yet. That will be a determination that will be made by Pickens County Public Health. But I can tell you, and there was another question as well about rates, and they're so low right now. What do they need to get to in order for us to start looking differently at the approach that we're taking to reopening the community? And so I would just offer that what the kinds of measures that we're working right now on developing aren't related to infection rates, because rates that require a denominator of how many people there are in a community, et cetera. And we're really not focusing on that. Instead, we're focusing our recommendations to Pickens County Public Health are to focus on the downstream effects. So what we're monitoring closely is hospital capacity. So we are concerned, we would be concerned about the fact that our number of patients coming to the tent would suddenly increase and continue increasing in a trend. If suddenly we're seeing more patients in the emergency department and that number is increasing, and certainly our rate limiting factor becomes when patients have to be hospitalized and or ventilated. That's when we have the least amount of capacity and we are putting lives at risk. So those are some of the hospital capacity related indicators that we are feeding into public health on a daily basis. And what we're looking for, again, are trends. It's an excellent question then about at what point would we get to the opportunity to be able to stop some of these 5 responsibilities. And I don't really feel like I can speak to that other than to say when we start seeing that we really have very little incidence of virus in the community that we're concerned about. As long as the virus is in the community, we're going to remain concerned about all of those 5 personal responsibilities that have been articulated today. Any amount of virus in the community needs to be kept in the box and not transmitted. So beyond that, public health staff, I think, can speak. Epidemiologists can speak much more intelligently about rates, unless one of our physicians would care to offer any additional feedback.
I can weigh in real quickly. I think Dave kind of combined a couple questions there, which were definitely related. So in terms of the triggers, for scaling up or scaling back are, as you said, we're in the process of developing those specific triggers and those specific thresholds, those numbers. So we don't have the exacts yet, but we're determining exactly what will be those factors and what exact numbers we'll need to look at. And of course, we also have to take that into context of our surrounding areas because we don't live in a bubble. So we need to know what our resources are going to be available to us down at Valley View Hospital in Denver. So if they're seeing large surges, and even if we're still staying low, we may need to take those things into consideration. So we are actively working on those parts, that exact question, and hopefully we'll have more information in the near future. There was the other question about specifically when can we take, what threshold can we reach to, stop wearing masks? And I did see the question, and yes, I think right now there is unfortunately some stigma against people that are wearing masks. And I think what we'd like to do is we kind of want to normalize that. This may be our new normal for a while, and we don't know how long it'll be, but there's a good chance this may be a while. And we don't want to stigmatize people. We don't want to make anyone feel badly about themselves or their choices because they're wearing a mask and following recommendations. And so I would encourage everyone, for me, that's just one more reason to wear a mask, is just because it makes someone else feel more comfortable about their own personal safety. So please, I think, again, just encourage each other. Let's normalize wearing masks and taking some of these social distancing precautions and all the precautions so that we don't feel like we're the outsider when we are following these things. Because our mental health is very important, and we recognize that, and we want to work with everyone to improve that.
That's great. Thank you, Dr. Holmes. There's a question here that I'm going to tackle. It says, does anyone know about closing some streets to have more restaurants have outside seating? And it's a really great question. I know that the Aspen City Council tackled this conversation, at least started the conversation on their Monday night meeting. I know that the engineering and the comm dev department have been looking at how to make that a potential possibility for the city. And I do know that they'd really like some feedback from the restaurants and businesses at aspencommunityvoice.com. So we have a website where we can have an engagement kind of dialogue around that very conversation. So for whoever sent that question, it's a great one. And if you would kind of put your feedback into that aspencommunityvoice.com page, I think that would be really helpful for the city council and the city staff moving forward. So, all right, let's see, there's lots, they're coming in fast. All right. The county daily update is great. Thank you. Is there any way to see a graph of the results over time? Are we flattening the curve? Somebody want to tackle that one?
Ooh, I've got that one.
Great.
Because in fact, we have flattened the curve. I mean, that's what Dave was trying to say at the beginning. We reduced transmission first by making everybody stay put, right? We weren't mixing people, and we know if you don't mix people, you're not going to transmit virus as much. And we did that, and we stayed that way at the hospital, and we have stayed that way flat for the whole month, really. For the last 4 weeks, we've had an average daily census of about 1 patient. That doesn't mean it's gone. We still have virus. We're just flat. Now, when you get so low to a place where you have 0 to 2, average of 1 patient, it's really hard to show a trend, either down or up. And when you're looking at data like hospitalizations, which has a lag to it because it takes you 4 or 5 days to get symptoms, 10 or 12 days to get really sick so that you need to be admitted, that's the time frame, that lag before you see things. So we've been flat for quite some time, despite moving to more normal mobility. And I don't have a graph, I'm using my hands, but we did do this in March, then we went back down, and now we've been flat since a whole month ago. So again, great job, everybody.
And we are working on a dashboard that will have a number of different measures that we can share with the community to look at these measures over time, and that is still forthcoming. So we hear you, and we're working on it.
Great, thank you both. All right, I hate when this jumps around. Okay, to the business compliance team, are you ready to accept proposed safety plans for hospitality businesses yet? We will use the checklist and attach the details of our plan or submit it as a standalone document.
I'll start. Thank you. I think that's a great question. We haven't even considered yet, to be quite honest. I know that there's a couple different proposals going around, and Bob Schultz, our business liaison, is working within the lodging community. And so I would say our approach will be, let's work within that task force group that is building out, and we can kind of work through there and disseminate through the chambers how we should begin to accept those checklists from the lodging community.
Great, thank you. Okay. Somebody see, are you guys getting to read the Q&A also? Okay. Okay, here's one I thought that was a good one. Can you give examples of low, moderate, and high risk activities? I think that kind of goes back to your chart you had.
Sure. Kara, you can help me here. As we think about low risk activity is probably hiking outside, so either socially distanced or by yourself, it's super low risk. High risk would be playing a game of basketball. You're sharing the same equipment. You're really close to other people and touching. And then moderate activity, what would we put in there?
I think moderate is probably, as we think about phase 1, it's your Pilates studio, your personal training of 4 people to 1 instructor. You might have equipment that you're using during that one session, and there's a big disinfection between that. So there's no shared contact during that. You're socially distanced within a group, but it needs to be a disinfection protocol between uses.
I would just add, if I can, when we look at the data out of other countries, so for instance, New Zealand, which is an island that really could kind of close everything down and had a great way to test and trace, half of all their viral transmission came from large group events. So that is really something to think about. That's why we went to a max of 5, and now we're loosening a little bit to a max of 10. So when we talk about high risk, large groups of people is definitely high risk.
Great. All right. These are great questions. They're pretty detailed. This one's a tricky one, but I'm going to read it and we'll see how you guys feel. Pickens County can have a great plan, but we do not manage our ports of entry. So I do not understand how you manage the influx of virus when we welcome outsiders again. I would say visitors again. How do we really manage the spread of this virus when regional and federal plans do not align? Ooh, that's a weighted one. Jordana, you want to grab it?
Sure. So, I think that's a valid point. We've recognized, as Dr. Bernard has said, as we've shut everything down and we haven't had any influx, we've been able to manage and have very low cases and number of cases and low spread. We know that opening up to visitors is going to be what's risky. And so right now we're really doing a lot of planning, especially with the airport, knowing that that's a major port of entry for us. And what does a gold star screening program look like? We know that it's more than just scanning for temperature. We know that it's symptom, checking everyone who's coming in for symptoms. Those who are screening positive, being able to test them quickly, get the results back, and then if they are positive, being able to isolate them. So I appreciate that question, and that is something that is being worked on, and we will have more of a plan to share with the community as that begins to get developed.
I'll add to that too, Jordana. I've seen a video that we've created with John Kinney at the airport too. I mean, again, they're working really hard. There's no, again, FAA regulations even out there about what airports should be doing. So it's really a local community response to how we're going to handle that influx of people that want to start coming back in. So just stay tuned with us. Again, our websites are chock full of a lot of information that really can hopefully help guide that conversation moving forward. This thing jumps around, you guys, the Q&A. I think I'm on one, and then next thing you know, okay, hold on.
Can I also just weigh in real quick?
Sure.
I also just want to add that, again, this is another reason just to reinforce the 5 commitments, right? So even if we have people that are coming in and they may have the virus, socially distanced, 6 feet away, everybody wearing masks, encouraging others to wear masks, it's going to reduce that spread, even if people with the virus happen to be coming in. So just one more reason.
When school starts again, are the students and staff going to be wearing masks? That's one that's, I think, a little bit too far out for us to answer at this point, but does anybody else want to add to that? No?
I would say that we'll be looking to state guidance into the schools that will really be leading the charge on that one.
Okay. I work for an event planning company here in Aspen, and we are wondering what the summer will look like as far as larger gatherings for weddings specifically. There's a rumor going around that gatherings of 250 will be allowed in Pickens County by August. Is this accurate?
So it sounds like people are doing some calendaring and math with the roadmap to reopening. So I don't know if I can give, date ranges right now, but if you take that roadmap to reopening, we know that we're in phase 1 right now, which limits group size gatherings to 10, that we're slated to head into phase 2, which limits group sizes to 25 to 50. We're slated to move into phase 2 on, what month are we in? May 27th. And then 4 to 8 weeks after that, if our data and the criteria look good, that the curve is continued to be flattened, our capacity of the hospital remains intact. For 4 to 8 weeks from May 27th, we would be able to move into event sizes of 250. So if you do that math on the calendar, that will give you the date range when that might be possible. And the tough part is that it's always qualified with the fact that that's pending everything. Our data is looking good. We're flattening the curve. There's always the possibility that we can roll things back or pause in a phase if the data isn't indicating that we can loosen the regulations.
There's a lot of great questions in here that are kind of around the criteria and the data. I can share with you that we're really looking at next week having our epidemiology team here to kind of talk in a little more detail about what we've been tracking in Pickens County. And again, those kind of markers for those, how those phases, get changed based on what we're seeing come in. So, be sure to tune back in next week also, but there's a couple of questions there that are repetitive around that. And I want you to know that we're really going to give you a little more in-depth look at the data conversation next week. Where do gyms fit in the reopening process? This is one that came up a lot since last week.
So per the state guidance, gyms are not allowed to open. So the caveat with that is that personal training of sizes 4 people to 1 instructor max may operate in a space, and that there needs to be no shared equipment between those users. Again, similar to the Pilates example I gave before. So gyms are not allowed to open except for the small class sizes of 4 people to 1 instructor. And that information is up on our FAQs as well to give a little bit more clarity there.
That's phase 1 that Kara is discussing, and I'm going and looking at the roadmap right now. So there's a category for gyms and Kara, I don't know, and then looking forward at phase 2, it says guidance to be determined. So we're still waiting to hear to base off of state guidance if phase 2, if that seems like an activity or a kind of opening that is appropriate for that phase, or if it would be more appropriate for phase 3.
Great. This is another question. I think the AVH team can help us with this too. No, that's the one. Oh, geez. I hate how this thing jumps down. How will contact tracing work if someone gets ill? Will all people who interact with that person be quarantined for 14 days, or will they be allowed to return to work life if they test negative? And both our PH team and maybe AVH has some thoughts on that. Do you want to talk about contact tracing, Jordana?
Sure. So when we do contact tracing for when someone tests positive for COVID-19, the public health department reaches out to interview them and figure out who they've been in contact with during that period when they would have been able to spread the disease to others. And so that interview will go through and figure out, have you been within 6 feet of someone else for a period of time longer than 10 minutes? Will you have been in other places, and what kind of protections were in place? So as you're thinking about, back to these five commitments, if you're staying more than 6 feet away from people, if you're always wearing masks, when you're going out and doing these different kinds of activities in the community, you're going to reduce any chance of spread to other folks. So that's another reason why we're thinking about when you're doing your activities, just keeping that distance and protecting yourself if you might be contagious, or if you're coming into contact with somebody who's contagious but they don't know it yet. It's why it's written into our transportation guidelines for you to think about for yourself and for your business. Taking your own vehicle to work is going to be the safest thing for you to do. If you choose to make the decision to carpool with someone for a longer period of time, that would put you at risk. If you were with them when they were contagious for COVID, you would be identified as a contact, and you would need to quarantine for 14 days to see if you develop symptoms to COVID, if you're to be tested, and see if you're positive, or if you just need to wait for those 14 days to see that you don't develop symptoms. So it's really important, I think, for our community to understand what would make you a contact to somebody if they do develop COVID-19, and what would keep you outside of that risky window. So really thinking about, again, those importance of those 5 commitments.
Great. Thank you, Jordana. All right, AVH team, what is the status on elective surgeries, especially ones that require physical therapy long-term?
So thank you. We are performing elective surgeries now. We are still prioritizing those surgeries based on patient need, and we are also screening the patients and testing the patients in advance of the scheduled surgery to make sure that they don't have a positive result. So it just depends on the nature of the surgery and the nature of the patient's need. Contact your surgeon and talk to them, and they'll be able to give you a good sense for what the timing would be. With regard to physical therapy, we also are now having more regularly scheduled patients in our physical therapy department, but we are also still doing telephonic consultations with patients to try to reduce the need to have to come to the hospital. But the need for physical therapy, if that's what the question is, will preclude somebody from being eligible for the elective surgery. The answer is no. We are providing those surgeries and providing the physical therapy that follows, again, always subject to patient condition, screening, and need.
Great, thank you, Dave. Jordana, this might be one that you tackled last week. Will visitors need to quarantine for 14 days going forward? Why do second homeowners not have a quarantine requirement?
That's a great question. So to be clear, in the current public health order, there is no requirement for a 14-day quarantine for anyone coming into the community. I can expand on that.
Okay, yeah, go a little further.
So if you're currently under phase 1, those that are permitted to travel into the community are second or anyone who is a homeowner here, whether it's full-time or part-time, and their guests. So those are, other than that, we are still requesting that people don't travel to the county, but residents and homeowners of any kind and their guests are permitted to come into the county. And that's why with the closure of any kind of lodging options, any kind of short-term lodging options are currently closed right now during phase 1. So you would need to be coming as a resident, and that means you have a home or a guest of a resident who has a home to come into the community. We're not requiring a quarantine, but again, just committing to those 5 commitments is going to keep us all safe. If you're coming from a place that has super high rates of COVID, or if you feel that just acting responsibly. If you feel like you may have been at risk, may have had a contact, we're just asking people to really use their best decision-making power and judgment to keep themselves, our families, and our community safe.
Great, thanks, Jordana. I know Dr. Levin has talked about this, but maybe you guys can tackle this one. If Pitkin County has 1,000 antibody tests and could possibly procure more, why is AVH or Pitkin County not designing a statistical and scientific valid study to see how wide and far this virus actually went? Dave, is that one you want to tackle? I know we've talked about the antibody test quite a bit.
I think I can jump on that one.
Dr. Holmes, great.
So in order to design a study to determine what percentage of the population has already been infected and what the prevalence is, we would need to have a test that we can truly rely on. And unfortunately, we just are not certain yet that the tests that were acquired have the correct accuracy that we would need. So there's a term called specificity, which basically means that there may be, or which correlates to the number of false positives. So the number of people that would test positive but actually never had the disease. The test was incorrect. And we just don't know about that right now for these tests. There's been a lot of tests that are out on the market. Right now, there's over 90 different antibody blood tests out on the market. And only, last time I checked a few days ago, it was only 12 had, they were not even FDA approved. They were approved for emergency use authorization in the course of a pandemic. So the ones that we have acquired have very little data to back up how accurate they'll be. And so until we know that information, the county has decided to hold off on using it because we're just afraid we would have a completely inaccurate count. So we're hoping there may be more data coming out from this company that we bought the test from. And if that's the case, then we'll be able to use them, but we're still waiting at this time.
Great, thank you, Dr. Holmes. I think Jordana and Kara, I understand short-term rentals have not been addressed as they are understandably a very low priority. I'm assuming that hasn't changed, but please update if there's new information.
Yeah, so again, through ACRA and the Lodging Task Force, they are working on a definition to segment out short-term rentals and lodging. And so what the definition we're working on right now is that anything that has a property manager, or even kind of the working definition right now is has a front desk. So you still might be listing those condo units on VRBO or Airbnb or whatever, but that they are managed by a property owner or have a front desk, those are the working definition that we're looking at moving into the lodging definition. But under the state guidance, all other short-term rentals are not permitted at this time.
Great, thank you. All right, there's a follow-up on the event question. Specific to the hospital capacity looking toward the larger gatherings in the fall, will potential flu cases or sickness change how things are looked at if COVID numbers are flat, but flu numbers are on the rise?
I'll take that. So the condition that we're looking for is COVID. And so now that we are testing and tracing, we'll have positive cases identified. And if they're not COVID, and also I have to add to that, though, that it also depends on the physician evaluation, too. There are other diagnostics that are used, radiographs, CTs, et cetera, that would also have to indicate that it's not COVID, and likely a positive flu test. So if it's something different, if we're seeing an increase in the incidence of flu, that's not what we're boxing in right now. So it wouldn't, and also as Dr. Holmes pointed out earlier, the flu does not have the same downstream effect on patients needing hospital care that COVID does. So they're two totally different illnesses. And so we would not anticipate from the hospital's perspective that we would be recommending that the flu have an impact one way or the other on the suppression measures, the suppression plan. So if either of you physicians disagree with me, please say so.
You're good, it looks like. All right. We're getting close, gang. We only have a couple more minutes. And then, like I said, thank you for everyone who's joined us today. If we haven't gotten to your question, our team will try to look at it in a little more detail and provide that on our FAQs on our website. Any thoughts on types of masks or where to look for recommendations? And it says CDC, et cetera. So maybe Dr. Holmes or Dr. Bernard, is there, are the homemade ones, they do the job, right? Or they can do the job.
Sure. If that's a question about what type of mask we should be wearing outside of the hospital, any cloth covering that's going to catch what's coming out of your mouth and nose is what you want. I mean, I've seen all sorts of different things. My two young sons and I made some on Easter Sunday for fun. You can make them out of dresses. The best materials really are the ones you can breathe through but aren't totally see-through because you don't want things coming through them. And I heard Karen Koneman say on one of these previous meetings, you know, they need to be washed daily. Those are the big things.
Okay. All right, gang, I kind of think we're wrapping it up. We're getting really close to 5. Is there anything else you guys want to share with closing, or it's been a day? I appreciate your time. We always do. I know the community really appreciates hearing from this group. And again, our goal is really to next week, and we're kind of trying to stick with Thursdays, probably in this time slot, to bring you a little more information around some of the epidemiology modeling that's happening and the data that's being collected. And again, those points that they're looking at for how we inform the next phases of our roadmap to reopening. So again, thank you for joining us. Stay tuned, and you guys have a great night. Thanks for being here.